Hi, my name is Tess, and I did my project on paranoid schizophrenia. So, what is the disorder? Schizophrenia basically means split mind, and it's a psychological disorder that's characterized by delusions, hallucinations, disorganized speech, and/or diminished or inappropriate emotional expression. And I got that from our textbook. So, with schizophrenia, the symptoms are put into two relative categories, which are positive and negative symptoms. And in paranoid schizophrenia, patients often exhibit just positive symptoms, but that does not mean that they cannot experience or show negative symptoms as well. So, like I just said, the symptoms for schizophrenia vary in every patient, and some experience mainly positive symptoms while others experience negative ones. So, the positive ones are hallucinations, exhibiting inappropriate behavior. So, for example, that would be crying at just a random time or laughing at, say, a sad moment. Deluded ways or thinking. Negative symptoms include absence of appropriate behaviors. So, for example, that would be like having just, if it's a funny moment, they don't laugh, or if they're supposed to be crying, they're not crying, and a toneless in voice or expression, mute and or expressionless face. And some patients often report that it's very internalized and it's as if they're talking to another person, but that person is just in their head. And like I said, the DSM 5 has identified five main symptoms, which I just stated. So, the causes for schizophrenia, I put in a little quote from the Mayo Clinic. It's not known what causes schizophrenia, but researchers believe that a combination of genetics, brain chemistry, and environment contributes to development of the disorder. So, for what I listed as the causes, I put bloodline, which is hereditary. So, if your mother has it, then you're at risk for developing schizophrenia, and by developing, I mean it laying dormant within your genetics. And going on to the next one with a stressful event, you can be completely normal and a stressful event occurs, and that laying dormant schizophrenia can be triggered, and you can then start to experience symptoms, and you can go on to get diagnosed as a schizophrenic. So basically, it's an overproduction of dopamine in the brain, where your brain just produces way too much dopamine, and that's what triggers the hallucinations and such because it has nowhere else to go. And I took a little quote from our textbook because I thought it applied to this. No environmental causes have been discovered that will invariably, or even with moderate probability, produce schizophrenia in person who are not related to a person with schizophrenia. And that's by Susan Nicole and Irving Gottsman. So the case study that I chose was Allie Burke, and she's a 30-year-old woman and the vice president and executive chair board for Stigma Fighters, a nonprofit organization that gives people with mental health illness a platform to safely share their experiences. So Burke first started experiencing symptoms in her early adolescence around 6 years old, and it first started when she was about to go to bed. She was seeing hallucinations and hearing voices, and according to the DSM 5, people with paranoid schizophrenia, it's not irregular for them to experience hallucinations right before bed. She described them as black shadows and figures on the wall that would move and sometimes not. The voices were dark and they sounded whispery and scary. So, a little more context, Burke had a really rough childhood. Early on, her parents divorced and she began to live with her mother and her brother, except her mother began to substance abuse and she just wasn't taking care of the children. And so, starting into middle school, she moved in with her father, and that's when the symptoms started to get worse. Moving into high school, she began to experiment with self medicating with drugs and alcohol, which did not work. In college, the symptoms again grew worse, and during a test, that was the first time she actually began to experience symptoms during the day, and she heard a voice, and she said that that was all she could hear during it, and she couldn't take the test. Um, she later on learned that two of her family members also began to experience these and were currently living with the same struggles. So for Allie Burke continued, for the next 2 or 3 years, the symptoms began to go again even worse, and she was seeing things such as black shadows and monsters on the wall, and they became more animated. And she described one as a big spidery figure that was crawling, and it was 3D for her. The voices grew persistent and were very close to my ear. It's almost like a whisper. It's like if a shadow could yell. So she was first diagnosed with schizoaffective disorder when she was about 26, and then 2 years later, when she was 28, it was actually corrected to paranoid schizophrenia. So the delusions that she experiences are fear of being poisoned. So she cannot leave her drink or set it down where she cannot see it. So for example, if she sets her drink down, leaves a room, and no one enters that room, then she comes back, she believes that her drink has been poisoned or her food has been poisoned. She hears voices in languages she doesn't know or understand. She sees shadows and figures on and around walls. And she also experiences self-deprecating voices such as, "You're not worth it, you can't do this, like, you don't know what you're doing." She has identified her triggers over the years, and it's mainly just stress and feelings of being overwhelmed, such as like panic and just extreme anxiety. For Burke, it actually took years to figure out which medications worked for her because there's so many. At the time of her diagnosis, she did not have insurance, which made it very difficult and very expensive. It took about 5 years to get the right mix of medications for her. So, the medications and treatments that she takes right now are psychotherapy, so discussing with her therapist about things she experiences, what she's going to do about them, and how she's going to deal with it, and an alternative vibrational therapy partnered with yoga and meditation. So, vibrational therapy is again, alternative, and it's still experimental. It uses vibration as a tool to target areas of discomfort and tension. For Burke, near the temples of her head and like kind of the back area. And a quote to prove that, well, give an example, as yoga as a therapy has proven to be effective as a sole additional intervention in psychiatric disorders such as depression and anxiety. So for her, it just lowers her anxiety, which lowers the chance of her getting triggered and causing worse symptoms. So currently, Burke is taking 5 medications. She takes 3 in the morning and 2 in the evening. The morning ones that she takes are duloxetine, which is an antidepressant, bupropion, antidepressant, and buspirone, which is an anti-anxiety. And at night, she takes zolpidem, which is just another name for Ambien, and it's a sleeping pill. Then she also takes an antipsychotic, olanzapine. So various treatments and medications, just in general. Treatments for paranoid schizophrenia are lifelong, whether that be therapy or medication, but some people cannot afford that, and that's why they end up going homeless or just losing their home and their family. Paranoid schizophrenias are most commonly treated with psychotherapy and cognitive behavioral therapy along with medication. So the most commonly prescribed are antipsychotics, which include Seroquel, Zyprexa, Reluxity, and Abilify. And Burke has actually been on Seroquel and Zyprexa, but she reported that they did not work for her. The main goal of the medications is just to reduce or relieve symptoms of psychosis, such as delusions and or hallucinations. The treatments that are commonly used other than medications are just psychotherapy and CBH. And CBH, also cognitive behavioral therapy, aims to make people aware of their negative thoughts and irrational thinking to help them cope and understand. So, getting help and advice that one would receive. So, if you were homeless or living on the streets and just didn't have that much of a structural support for you, you would either be picked up by police and probably flagged, and either if you were charged with something, you can voluntarily admit yourself to a mental health program, or if you were charged with something, you would have to subject to, well, be put in involuntary psych hold, and sometimes you don't know how long that would actually be. Some cities offer help, but little comes of it, and oftentimes they're underfunded, and some of the patients just choose not to proceed. So, family support is actually very important, and you can be treated through medications and you can see a psychiatrist. You can also attend therapy through insurance or other parts. So, by other parts, I mean you can either pay in cash, which is an immense amount of money, or you can go to group therapy, such as support groups that are also public, and most of them are free. When you get treated through medications in your insurance, it's again very expensive, and you don't know sometimes if they'll be able to get refilled. So it is kind of risky for some families. And along with the family support, you can go to a family therapy where it teaches the family and the patient how to deal with the symptoms, to learn what their triggers are and such. So the sources that I used are Allie Burke, Living with Paranoid Schizophrenia by Vice, her blog, and also her other workplace, which is Stigma Fighters. I also use the textbook, DSM-5, the reading guide, the website schizophrenic.nyc, the Mayo Clinic, and the Cal Hospital Guide to Dealing with Mentally Ill and Police, which applied to California.